Recording. Thank you. All right. Hi, everybody. Thank you for joining us for today's Health and Action Work Group presentation. My name is Emily Bear, and I'm one of the site engagement coordinators with MVC, and it is my pleasure to be facilitating this work group for you today. All right. Hopefully everybody can see my slides up here okay. Today's work group is going to feature a presentation by Sarah Evilsizer. I'm so sorry, Sarah, I did not ask about the pronunciation of your last name.
You nailed it. All good.
Awesome. And Beth Seese, awesome, from the Overdose Prevention Engagement Network, or OPEN. We'll probably be referring to OPEN throughout the rest of the presentation. So just some brief bios. Sarah is the clinical implementation nurse at OPEN. She's worked at Michigan Medicine for over 10 years, primarily in patient care and quality improvement implementation. Sarah received her Bachelor of Science in Nursing from the University of Michigan, Flint. And prior to joining OPEN, she worked at the Michigan Surgical Quality Collaborative and the Obstetrics Initiative, managing clinical data abstraction and quality improvement implementation. So welcome, Sarah. Beth is the program manager at OPEN, and prior to joining the OPEN team, she served as the program manager for the Michigan Surgical Quality Collaborative, a Blue Cross Blue Shield of Michigan Collaborative Quality Initiative that focuses on general, vascular, and gynecologic surgery. She received her Master of Science in Clinical Research Administration from Eastern Michigan University and a Bachelor's of Science from Michigan State University. She has a strong background in the conduct of clinical trials, regulatory management, and the development and implementation of surgical quality improvement. So welcome, Beth and Sarah. They are going to co-present a overview of OPEN for us today. And I'm very excited because I already got to preview their slides. But before we start, I did have a couple of housekeeping notes to review. First, this work group session is being recorded. But that's good for you because that means the slides and a recording of this presentation will be made available to you following the conclusion of the work group. So be on the lookout for a follow-up email from MVC. Next, we will be holding questions until the conclusion of Sarah and Beth's presentation, but please feel free to add questions as they come up to the chat throughout the presentation. We'll be monitoring that and then have a designated Q&A at the end of the session. And then lastly, your feedback is very important to us. At the conclusion of the whole presentation today, we will provide you with a link to a post-work group survey, and we would greatly appreciate you completing that. As a reminder, for those of you present today participating in P4P, completion of that survey is mandatory to receive credit for your participation today. And with that, I will pass the torch over to Beth and Sarah for their presentation.
Thank you.
I will share my slides, Emily, if you, let's see.
Let's see. Stop share. Now you should be able to share.
All righty, and you're seeing just the slides, right? Okay, perfect.
Great, I will kick us off. Good afternoon, everybody. Today, we're presenting, as Emily said, on behalf of OPEN, the Overdose Prevention Engagement Network. And we're so grateful for the opportunity to share all of our work with you. Our plan for the brief presentation is to give you an overview of who we are, share some info about our provider and community programs, and introduce ways to perhaps partner with us moving forward. So OPEN is led by a number of Michigan medicine faculty with various specialties, including surgery, anesthesiology, and behavioral health. Next slide. you've already heard plenty about us. Thank you, Emily. I'm the managing director, and Sarah is our clinical implementation nurse, and neither of us have any disclosures. So to give background on our organization, we are the product of a recent integration between the Opioid Prescribing Engagement Network, also OPEN, and the Michigan Opioid Collaborative, or MOC. So initially, OPEN focused on prevention, so guiding providers in safe opioid prescribing and management of acute pain. And MOC previously focused on treatment and access to treatment for opioid use disorder. As of January 1st of this year, our two groups have combined and we've rebranded as the Overdose Prevention Engagement Network. So still open, but a new open. And this is a strategic collaboration and allows us to more broadly address the full continuum of care for opioid and substance use disorders, from prevention through treatment and recovery. And now our organization provides education and resources across a number of initiatives. We provide targeted and up-to-date information, and we use this as our foundation for engaging with providers and engaging with communities. So while OPEN is not a CQI, we do aim to partner and support hospitals in this SUD space, both inside and outside of collaboratives. So we have engaged with a number of CQIs to create impact, improve care quality. For example, MSQC and OBI were strategic in helping us create our opioid prescribing recommendations, as well as our pain management best practices. And we've also partnered with MEDIC, so the ED collaborative, to create naloxone distribution pathways within the ED. And there's been a number of other collaborations with MVC and other CQIs as well. So these networks are extremely awesome to help disseminate this work. And with that background in mind, I will pass it over to Sarah, and she'll share a little bit more about the clinical support and programs that we offer, and touch on some of our future goals.
Yeah, thanks, Beth. So yeah, we'll take a look at some of the clinician provider supports that OPEN has to offer. And some of these are newer as a result of our integration with the Michigan Opioid Collaborative. We offer expert consultation services. So we have a team of physicians and a pharmacist with backgrounds in family medicine, addiction medicine, psychiatry, and then pharmacy, as I just mentioned. Our team is able to provide same day, expert advice and guidance to providers who are treating patients who have substance use disorder and or complex pain management needs. Submitting a consult request is super easy using our online form, and we'll triage that to our on-call provider and then return your call that same day. So again, free and hopefully easy to use and get expert advice. We also offer educational webinars and trainings. Usually monthly, we have an educational webinar focused on a topic around substance use disorder or pain management. Many of our webinars offer free CME, CEU, and MCBAP credits for people who are peer recovery coaches. And then for prescribers, all of our credits also qualify for the new DEA required SUD training that was put into place of June last year. We also provide MOUD trainings quarterly. Those are 4-hour virtual trainings. And this year we are providing an incentive for primary care providers, so physicians and advanced practice providers that are in primary care, with a $250 incentive to complete training. The next one we have coming up is in September. And our hope here is really to encourage confidence and willingness to help expand access to life-saving treatment for folks who are experiencing OUD. We also have recorded educational opportunities available on our website, and some do include on-demand CME and also qualify for that DEA required training. Oh, clicked the wrong button. Sorry about that. Okay. So moving into some of our community and organizational supports, Open has a free library of resources. Some of them maybe you've seen before in terms of, prescribing and pain management, but a huge library with many resources available for providers and for patients. For our patient resources, we offer co-branding of materials, so you can submit a request to us. We will add your organization's logo and then send it back to you in a PDF that's ready for printing. Importantly, most of our patient education is also available in Arabic and Spanish as well as English. And we'll send the slides out, I believe, afterwards, but there are a few links here that you can click on of things we pulled out that might be of interest to this group. But again, plenty of things on our website, so please do check those out. We have a number of programs, other programs that folks can apply for around safe storage and disposal of medications. So our safe storage program is for locking pill bottles. Sites can request to receive up to 250 free locking pill bottles. We launched this earlier in 2024, and it's been quite a hit with sites. We've had lots of requests and distributed lots of pill bottles. As you can see here, it looks pretty much like this. It is a pill bottle. They come in large or small sizes. At the top, there's a combo lock code that patients can set to help keep their medications safe. We also have a few disposal options. So we offer permanent disposal boxes and fully fund them for up to a year. We have home disposal options that sites can apply for. There's deterra bag pouches where you just put the medication into the deterra bag, add water, and then it goes into the household trash, or you can apply for mailback envelopes where they're returned in the mail and then destructed. We also offer overdose rescue training. These can be virtual, live, or in-person trainings, but again, focus on how to recognize an overdose and administer naloxone. We've done hundreds of these trainings, and they can be we've had trainings for high schools, for corporations, for businesses, for healthcare providers, you name it. We've probably had that type of group that we've done a training for. So they're very customizable, and again, a free program that we're able to offer. Open also can fund naloxone vending machines or distribution boxes. So if you think about a newspaper box, that's now become a resource to help distribute free naloxone. So sites can apply to have either the vending machine or the box funded by Open. And then the site is responsible for keeping the boxer machine stocked, but naloxone is available through the state portal for free right now. A couple notes about the programs that we just talked about. Well, first, there's more on our website. We picked out a few that might be of most interest to this group, but please do check out our programs page on our website for more. There's a few programs listed here that are done on a cycle basis. So we're currently accepting applications for these 4 programs, and then we'll send award notifications in March of next year. But for the most part, our programs are ongoing. So as you submit a request, we review those requests and fulfill them as we're able. So now getting into ways for potential partnership with Open. We continue to look for ways that we can provide tangible tools to improve the quality of care and patient experience. Recently, we've begun some work in substance use disorder screening, connections to care, and treatment for patients who are having surgery or seen in the acute care space. And through some of the research that Open has done, we've identified a few areas of opportunities for improvement that we'll share with you today. So just as some background, substance use disorder in surgery happens, and as many as 2 in 5 patients in Michigan in the pre-op period present with risky use of substances before surgery. And the most common in this study done by Dr. Fernandez was the most common unhealthy use were illicit drugs, followed by alcohol, tobacco, and prescription medications. And we know that risky use also from another study done by Dr. Fernandez has impact on patients after having surgery. So when we looked at 30-day outcomes among adult patients having general surgery procedures, you can see here the substances on the side and then different utilization after surgery and how things increase. Clearly, tobacco and alcohol together, risky use has the most increase in utilization after having surgery. Again, an important point to note here is it doesn't, the way that this particular study was done is it doesn't necessarily mean somebody had a substance use disorder, but that there was risky use identified. So one important thing to keep in mind. So after those two kind of papers that that came out, we started to think through how do we really identify substance use disorder or risky substance use even before surgery or in the acute care space. And so we started with some initial qualitative work and also leveraging some of the partnerships with the CQIs, particularly MSQC. And we did some interviewing to try to determine how do patients screen for substance use before surgery. And are there standardized tools that are used, or what are people doing? We think through when we're before surgery, we have care pathways, and we think we have A1C tests for diabetes, and we check blood pressure for hypertension, and other things that have some similar parallels. So we're looking to see is there some kind of standard that we follow? And from our qualitative work, we found that it didn't really seem like that was the case. So we moved on and conducted a pilot project here at Michigan Medicine, and we looked at over 240 patients' TAP screening reports. We sent patients a TAP screening tool to complete, so it was patient reported, and we compared those reports and results with what was documented in the health record after their pre-op evaluation for and looked at what their substance use risk was. And for background, and we'll go through it in a moment, is the TAP screening tool is a standardized, validated screening tool that looks at kind of substance use across the spectrum. So tobacco, alcohol, misuse of prescriptions, and other substances. So what you'll see on this slide here is that we found we really don't screen that well. When we compared what was documented in the EMR to what the patient reported in their TAPs, in their TAP screening. And, in general, across the board, the orange is the TAPs and the blue is kind of the usual care of what's documented in the EMR. And you can see that standardized screening outperforms kind of the usual care across the board. And in fact, in alcohol, in this category, the documentation, we didn't even really have enough information with what's documented as far as alcohol use goes to even be able to really calculate a risk score. So another point that came out of this work is that not only did the TAPS tool detect more patients at risk, but 70% of patients who were screened positive by using the TAPS tool were missed by routine EMR documentation. So when we look at their TAPS screening and we look at the documentation in the EMR, we're not seeing like that, yep, they're also screening positive using the documentation by the EMR. So that was some work that we recently did. And so we are, kind of taking these results and thinking, okay, what's next? And this is kind of a graphic of the TAPS tool that I was mentioning. And we've really been working to connect with other organizations to help support implementation of a standardized screening tool, such as the TAPS tool. In general, the work Open has done so far is using the tobacco alcohol prescription medications, which is focused on misuse and other substance use. So it's four domains. And in TAPS 1, the patient receives 4 initial screening questions. If there's a positive screening, then they'll move on to TAPS 2. And be asked 3 additional screening questions for only that particular category. So if a patient screens positive for tobacco use, then they will be asked 3 more questions about their tobacco use to calculate a risk score. We do have a newly published SUD in surgery toolkit guide that we'll put in the chat for you, but you'll find there's many resources on this particular tool, as well as implementation resources as we've been working to implement this at Michigan Medicine. So once we have kind of the risk assessment and we've done the screening, we understand kind of better what substance risk the patient may have. Really trying to look at it as an opportunity to improve care, improve the patient experience, improve any outcomes as best as possible. And so really, once we have that risk identification, having it doesn't have to be anything major, but a short, brief conversation with the patient about what we found in the screening and why it matters. How does it impact their surgical event or their acute care event? And then being able to make perioperative care modifications so that postoperatively, again, we're able to support patients and have as positive post-op outcomes. The other thing that is possible as we look at a patient with potential risky use is what happens kind of after their surgery or after their acute care episode. And we do lots and lots of outpatient procedures now. So you may have these different resources, hospital-based addiction, pain management referrals, and withdrawal management within the hospital. But the other thing to consider is community level programs and resources that exist that patients can be connected to, because they may have their surgery and it may be outpatient, and then you may or may not see them again. So just providing those referrals and resources can be a great next step. And that's another way that Open can offer support and help. As we integrated with the Michigan Opioid Collaborative, we have regional behavioral health consultants on our team that can help get, help you all get connected with local programs, community, county level, federal level treatment resources that are available. Because frequently, when we've talked about this, we, usually will hear like there's not a place really for patients to get referred to once we identify this positive screening. And so kind of what do we do next is usually the question. And I think the answer to that is there are things out there that exist outside of the hospital, but finding them can be really tough and time consuming and challenging. And so that's a way that Open can help to support you all in this work, is identifying and getting connected with some of those places. Another piece, and we've talked about quite a few of these already, but in education and support, also in the SUD toolkit that we'll share, we have perioperative planning tools, templates drafted out that can kind of help walk you through the steps of thinking through what happens when somebody screens positive. We have our provider consultation service that we're absolutely happy to help in some of the planning, and then pain management best practices for patients and for providers we have available. So with that, we'll go ahead and conclude. I hope that you all learned a little bit of something and found the information useful, have a better understanding of Open's initiatives, especially as we've expanded resources and support that we can provide. Again, we're happy to work directly with any of you, hospitals individually, work within CQIs, et cetera. So however is best to engage, please get in touch with us. I know Emily, you'll share our contact information with the slides after. So I'm happy to take any questions.
Just one question, Sarah, that I have on that note that you just mentioned about your contact. What
Yeah.
is you mentioned the resources in connection with local, regional, and community. What would be the best way for folks to get that information? Is it on your website or to connect directly with you and Beth?
Yeah, please. Yep. If you would just connect directly with us.
Okay.
I work closely with our behavioral health consultant team. And so that is who we would end up connecting you with is those folks. And they really have a great knowledge of how to find these things. I know since we've integrated, I've learned so much from them that I didn't know existed. So
Great.
we're happy to help.
Thank you.
Any other questions that?
I think Emily's was talking, but I couldn't hear you. No, sorry. Our team seems to have a theme of technical difficulties this week, so apologize.
Can you guys hear me now?
Yes, thank you.
I was just gonna note that while Sarah was giving that wonderful presentation, Beth had been populating our chat with a lot of really helpful links. So if you haven't already, you might want to go through and kind of catch some of those. For example, she added in a request for consultation, which Sarah mentioned at the very beginning of the presentation, and then some other more like specific links, which you might find on their website, but also might be helpful to just have those direct links too. And was there somebody asking a question that I ended up cutting off?
I did see somebody unmute, but I think I don't hear anybody. Maybe they're having technical difficulties. Well, but there is a question in the chat. Where does Open get their funding? I think you touched on that a little bit at the beginning, Sarah. If you could.
Yeah, we have funding from a number of different places, including some funding from the state. We also have some Blue Cross funding, Medicaid match funding, kind of a variety of places. Beth, do you have anything else to add at all that I missed?
No, we are fully grant funded, and those grants come from a variety of places.
And in regard to the the naloxone vending machines that you mentioned, what types of places have you guys been able to have those put in?
So, yeah, that's a good question. There's places in like within communities that you'll find vending machines. Probably the couple places that might be more unique are So at Michigan Medicine, there's one in the ED, by like the snack vending machines, actually. So there's one there. There's also one, is it by the outpatient pharmacy, Beth? I can't.
There's one in the ED, and then there's one in the cafeteria for the
That's right.
hospital, the main
Yeah.
hospital. And we also do the boxes are more popular for community spaces. And they often come to our application with partnerships in the community where there's groups that are willing and able to stock that machine for organizations. But I think largely we started with the intent of putting them in emergency room departments. Yeah.
That's great. Thank you.
I was really excited by the customizable trainings that you mentioned, Sarah. I know there was a link that Beth added to that on your resources and education training on your website. I was curious if anybody on the call had gone through that training with Open. And if so, if anybody wanted to chat about it at all. Doesn't sound like it. Well, it seems like it could be a really great opportunity. Is there like anything else about that training that you didn't get to touch on during your presentation? You feel like this group might want to know? You know, maybe a brief overview of like general topics or kind of how you might adjust it depending on the different groups that you might be presenting to?
Yeah, so we've done, like I mentioned, for the naloxone, the overdose rescue training, naloxone training, we'll call it, is so Dr. Gina Dallum is kind of our lead for that work. And in a healthcare setting, we would probably do a more thorough overview of, you know, recognizing an overdose, maybe recognizing an overdose in, you know, in the healthcare setting, perhaps, and various naloxone forms when you're in, you know, community. Mainly you will see the intranasal naloxone. In the hospital, of course, there's a variety of ways that you'll give naloxone. So those are some of the different components that it could be more in depth, depending on the audience. And we can see.
Just to add to that too, on the naloxone training. So some of the cool spaces that they've completed the trainings were on the floor. So discharge nurses, if they see patients with, you know, a number of medications that could put them at a higher risk for overdose, and creating that pathway inpatient to kind of make sure that they're prepared when they go home with naloxone and the education. So there's that floor nurse training is really a train the trainer model where they teach the team how to teach other patients and other staff members on what to do and how to administer, as well as the community layperson training is a bit different, where it's that basic overdose prevention training where how do you identify and how do you administer.
Great, thank you for that. Irene made a comment that she's very excited about the customizable education handouts, and especially that they are in 3 different languages. And also she feels that the training is a great opportunity that she plans to share with her organization's leadership. Awesome.
I just thought we can just share our website really quick. There's, like I said, there's tons of material on under Get Involved is where all of our programs and events are. So, you know, the programs like the consultation service, all the things that we just reviewed. I had briefly just clicked on the Overdose training program. So you would click on that and then apply now, and you'll just fill out a few pieces of information, and our team will be in touch with you. Under resources is where we have our, you know, publications, education and training. So the on-demand education that folks might be looking for with CME. Materials is going to be that library of printed materials that you can have co-branded, all of that. So again, patient and providers, for example, let's see. This would be a brochure that could be co-branded and is about managing pain after childbirth, which is in a patient brochure. You can see the 3 different languages here. So we have all of that, and then all of our initiative information as well. So just a quick tutorial of the website, but.
And then one of our programs is already printed materials for pediatric patients. I don't know if we have any pediatric folks on the call today, but we have packages developed and are able to send hard copies of the materials. We also have small trial packages, so you can get a sample of what is included in these materials. And then if it suits you, then you can request additional copies. Again, that's in the programs page.
That actually just brought a question to my mind when you mentioned the pediatric patients. In the study in the trial that you guys did at Michigan Medicine, did that include pediatric patients or just adult? Okay.
Adult patients, yep. Mm-hmm. Yep.
Just wondering.
Any other questions from the group? All right, if not, I'm going to share my screen again and just kind of finish up. All right, can everybody see my screen? Awesome. Okay, and you can still hear me too, hopefully. All right, so just before we conclude, I wanted to share the dates of the remaining Health and Action work group. There is actually just one left for this particular series. That's going to be on October 8th. And then additionally, coming up in the next month, we have a presentation on July 25th with our sepsis work group that's going to be given by Christina Ledbetter from McLaren, Oakland. She'll be discussing a formation of their Sepsis Excellence Committee. And then in early August, we'll have our preoperative testing work group. And Jenny Kinder from Ascension St. Mary's will be presenting on an update on their successes from pre-op testing efforts. Please note that all of our work groups occur virtually from 12 to 1, so during this wonderful lunch break. And as a reminder, to achieve the 0.25 P for P engagement points for attendance to the work groups, you have to attend all 4 work groups in that particular series and participate in at least 80% of that session. So be present for 80% of that session. All right. And with that, we'll conclude our work group session. I'm going to add, if I can get to it, the chat. I'm going to add in our link for the survey here for everybody. It will also be in the follow-up email if you don't catch that link. Give everybody to open that.
Thank you so much, Sarah and Beth. This was very informative, and I really appreciate you taking the time to share your knowledge with us.
Absolutely. Thanks for having us.
Awesome.